Hello everyone and welcome to Live in the D Extra. Glad to have you guys with us. And today we're going to be talking about a serious topic. It's called breast implant illness. Never heard of it? Neither had I, but we've got a familiar face to the show. Dr. Shaher Khan is here with us.
Thank you very much, Toddy.
You're also a breast explant expert, right?
Yes.
And we're going to explain more about that in a second. And we have one of your patients here with us, Kim Romanow. Thank you so much for being here and graciously offering your experience to us.
Oh, no problem.
We appreciate you. So first, Dr. Khan, what is breast implant illness?
So breast implant illness is a constellation of signs and symptoms that the patient experiences, be it soon right after or maybe even 10 years later, are a vague set of sign symptoms that the patient presents with. It may touch every part of the body, literally. So if you talk to the patients and they come in with their complaints, and most of the patients who have had this breast implant illness state that they have any of these 40, 50, 60 symptoms, from hair loss to headaches, changes in vision, brain fog, and I'm going to go top down so that it basically simplifies for the patients so that they can say, you know what, it's not the headaches only, but it is, for example, the brain fog. Very common. Patients are not maintaining well, they're not able to digest well, they have sign symptoms of vision problems, tingling, numbness in the bilateral upper extremities, weakness, fatigue, fibromyalgia type symptoms. They have inability to basically, for example, walk, even get out of bed. Affects breathing a lot, that I have seen a lot. That's one of the major complaints. It also affects their heart rate. I have had a lot of patients go to a lot of cardiologists getting heart rhythm monitoring and studies, echocardiograms, and then also the GI symptoms where they're getting colonoscopies, EGDs to look down. Vague sign symptoms.
All from breast implants?
Believe it or not. And then a major subset of this are the connective tissue disorders, which we know all along from the 60s and 70s when the breast implants first came out, that they have these rheumatological disorders, connective tissue, joint pain, arthritic pain, and then numbness, tingling, among the many, many others. Essentially autoimmune slash where the body itself basically goes on overdrive in an effort to fight off what is the foreign body slash the implant.
Which is the actual implant. So, and you said this can happen from 1 week after having the surgery or even 10 years later.
Yes.
Wow, that's really surprising, because I think if they lasted and you felt fine for 5 years, 6 years, 7 years, you would never think that it was the implants that are actually bothering you.
That is correct.
Right.
Now what it does is, there has to be a lot of studies that have to be done in order to define this, because if you go in and look at the ICD-10, which is the definition of illnesses or diseases, like for example, someone has a heart disease, you can look up the different codes. There is no such code that describes breast implant illness.
Interesting.
So because these patients, they have been to a whole set of doctors, their primary care doctor, GI doctor, like I said, the cardiologist, and they all say, psychiatrist, this is all in your head. What you're going through is something that is not related, because the implants have been deemed and determined to be safe.
Correct.
Now, if I can go back and look at the history, in 1996, the implants were banned.
Which kind of implant?
So these were the silicone implants.
Okay.
And then also, in general, because of the list of problems that they were, and this was back then, the older generation implants. In 2007, they were reintroduced as safe, and studies were done, and this was determined to be in the studies that the manufacturers brought out, and also the patients, that this was now able to 4th and 5th generation implants, what they call the gummy bear. But now, as we see in these patients that present, they have a very nice pattern of problems that they come in with.
Okay, well, Kim, let's go to you. Let's talk about some of the problems that you experienced. What prompted you to seek medical help?
Well, I had implants in over the muscle, 350 cc's in each side.
Saline or
saline,
okay.
yeah, the smooth ones.
Okay.
Thought everything was fine and stuff. I just hadn't been feeling well. Like, I was really fatigued. I had joint pain, muscle pain. I went to my family doctor. Everything's fine. I had night sweats. My skin was dry mouth, dry eyes. I thought, something's going on here. I need to get these checked out. And I really wanted to get them out anyway, because I know that it's not good to leave them in, that long as well.
How long did you have them before before you started to really experience some issues?
Probably about 6 years.
Really?
Yeah, and then I was afraid, you know, of what it was going to be like or that kind of thing. So, but then I, you know, finally got them out.
That's interesting because I would think, you know, in my mind, woman to woman, you would
Yeah.
think, I've been fine for 6 years. Why would these breast implants be causing me a problem now? But did you kind of have a suspicion that it was the implants causing these health issues for you?
Well, I looked through everything else, all my other health history and stuff, and I'm pretty healthy, no other problems or anything like that. And then so I was doing some reading on YouTube and stuff, and you know, and I just thought I'm going to get this checked out.
Okay, so then, Dr. Khan, how do you decide if a woman does need to have the breast implants removed?
So what needs to happen first is, remember, the patient herself can present with the signs symptoms of rheumatological problems.
Correct.
They can be predisposed to lupus, be it genetic or even patients who don't have implants, they are certainly getting these problems. Going to the primary care doctor and getting a initial set of workup, set of labs, rheumatological workup, the ANA, for example, rheumatoid factor, amongst the many other tests, going to your cardiologist, making sure that this is not an irregular rhythm. You know, there are young patients nowadays who have cardiac issues, so we want to make sure we are not basically attributing these sign symptoms to breast implant illness. You have to kind of initially do your homework. Now, unfortunately, today it's not a recognized entity. So going to the primary care doctor or to the rheumatologist or to the psychiatrist, all of them say, what is breast implant illness? I never, when I went to medical school, read up on this. This is something new, but very well defined in the sense that if you look at all these patients who have had the implants removed, you will see a drastic before and after picture. Now, all what one needs to do is just go on social media, and this is a social media phenomenon. You and I would not be here if this was the 70s and 80s before the world of the internet, because what happened was one lady got her implants out and she said, wow, look at me, I feel like $1 million. The other lady said, you know what, I went through all these series, I was on antidepressant for 2 years and it before finally kicked in, and I thought I was, because the body has its amazing ability to mask problems, be it depression, because this is something that is driving from the inside the body system and affecting literally, I would say, every part of the body.
That's fascinating.
And so what happened was, now if you go and look in these patients, now one patient, okay, I could be wrong, or the system could be wrong, or the explantation was a placebo effect, but you cannot have literally tens of thousands of women going online and saying, wow, all of a sudden my anxiety, my depression, I can walk 2 miles on Memorial Day, or I can now do cardio, I can go get my job back, or I can go ahead and function very effectively. I don't have to be in bed for 3 days. So all of that, now we're seeing a lot of patients coming forward and saying, this was it, this was it. And now we have a very nice feedback from the community, the nice ladies who are brave and strong enough to get on the Facebook or be it Instagram and say, I told you this was a problem. And now the picture is starting to come back what it was in the 90s, where you have a defined problem and we're starting to see that pattern. Now, there are a lot of women, if you look at the breast implants themselves, the average shelf life, i.e. the life on the patient, is 10 years.
So every 10 years, it has to be either replaced, or how does that work?
Or basically, if you look at a series of women who have had implants, on average, they last 10 years in the person's body. Some 2 years, some 35 years.
Okay.
I had a lady that I took care of, 82 years of age, that had implants inserted in 1976.
Oh my.
Yep. And so, and she lived with the same set. Now, very unusual, very out of the ordinary, and she had formed a capsule because this was her body's way of mounting and essentially capsulating this
actual implant inside
itself.
of her body.
Yes.
Her body created a capsule around
Correct.
it. Okay.
So this is a body's normal tendency. If you put in any foreign body, be it like a port or a pacemaker, it walls it off, and essentially the body recognizes it as foreign. Now, I have 5 titanium screws in my little finger. The body itself has walled it off, and it's not a problem. Titanium is different. Silicone is very different. Different chemical, different matter. As a biochemist, you will see 2 days ago I removed the entire implant along with the capsule, what they say en bloc, as one system, one entity. And when I cut it open such that after the implant and the capsule was removed out of the body, for the first time did the implant see air, you could see the silica within the capsule, because I send the capsule to the pathologist who looks at it under the microscope and determines what this is. Is it calcium or is it silica? And lo and behold, it came back as silica. Now you can only imagine if you leave that capsule behind, removing the implant naively, you have left the silica behind, which will continue to trigger that autoimmune response and continue to hurt the patient.
I think that that's key, though,
Yes.
because as a layperson, as you're explaining it, immediately I'm thinking the capsule has got to go as well. And that's an important part of the surgery. But now, Kim, let me go back to you. How quickly did you see an improvement in your health and your symptoms after having the breast implants removed?
Pretty much right away. A couple days later, I didn't have any of the pain, and my pain was gone. I used to have these shooting pains in my breast. Those were all gone. It was the weirdest thing. No joint pain or anything.
So this is a perfect example.
Can I say something, Kim?
Yes,
You were in the operating room just 3 days ago.
3 days ago.
Yes. You had the second
Yes.
implant.
Yeah,
I mean,
yeah.
and here you are.
Yeah.
I'll be honest, Kim told me this, and I said, wait, did she just say she had
Yeah,
the other one?
yeah.
You look great.
Yeah,
What
thanks.
was the experience like for
Well,
you?
I was kind of nervous, to go in because I didn't really know what to expect. But I went in, I saw Dr. Khan, and he told me like what my options are. I was looking on YouTube, and I would see all these people's breasts would look really bad, and I was like, I don't know if I can do this, But we talked about it. I went in at 8 o'clock. I was out by 10:30. It took an hour.
Dr. Khan.
And they have two little incisions about 1.5 inches long right underneath the breast. I took the next day off work, and I was fine. I've been back to work ever since.
And
Driving, I drove the next day. It was
That's awesome. Is this a typical experience?
So this is a very standard. So what I would ask all the patients and patients who are interested in getting the implants to kind of learn more about what they're signing up for, because this is not as simple as it sounds. Getting implants, and then you're going to be with the implants for the rest of your life without any surgeries. So it is a big decision to make. You have to make an informed decision, and it is a very critical decision, especially if you're in your 20s, because if you can imagine, and this is very well established, 10 years, and if you're in your 20s, how many times would you have to just undergo theoretically just to replace the implants? The other thing is, nowadays we find a lot of surgeries being done by a lot of different doctors. And I have to bring this up. This is very important because there are patients who are not truly trained, and it is unfortunate that we have patients that undergo the surgery where it is not done correctly or where you would want, because the training is intense and it is not as simple as having a subset of non-plastic surgeons putting it in. So it's very important for the patients to know who and what to, because removing an implant is one part of the story, where I say removing the implant and the capsule. Number two, every patient has a different story. One patient, if I may mention, had a ruptured implant. So, number two, going inside and then making sure there's no abnormal fluid, because you have to send the fluid to cytology, because you have to rule out the ALCL, which is the lymphoma, and aplastic large cell lymphoma, which is being associated.
Lymphoma is cancer,
Cancer,
right?
yes. And so this is why France a couple of months ago went out and said we're going to ban the textured implants for that reason, because it has been associated what they officially call BII, breast implant associated anaplastic large cell lymphoma, and for that reason they said it's banned, and so many other countries followed suit. So you have to, while you're in there making, and the eyes don't see what the mind doesn't know, you have to make sure that there is no abnormal fluid, because if you find it, you're obligated as a board certified plastic surgeon to send that off to cytology. And you're obligated in sending the capsule to pathology, because we want to make sure we're not going to miss on breast cancer. Now, one thing is a fact: 1 out of 8 or 9 women are going to get breast cancer. So that means if we have 9 women, 1 of them are going to. If I see 20 women, 2 of them statistically are going to have breast cancer. So while I'm there, I have to be doing an exam, making sure, because that's a good exam, I'm right next to the breast tissue, so that if there is anything pathologic, needs to go straight to pathology, because we don't want to be sitting on a cancer.
Correct.
So very important.
And that will only happen with a plastic surgeon, someone who's been trained
Yes.
to take all of these additional steps
Yes.
when removing a breast implant. And it could even be that someone is getting them replaced, but you still need that level of care
Yes, yes.
when you're making that decision to have the breast implant removed or replaced. But now, where can people learn more? Because you have an event coming up soon, and it's important to make sure
Yes.
people know about that.
So I will tell you, the patients are smart. They know what's going on, and it doesn't take much for them to know their gut instinct where I need to go. There's a lot of useful information, like Kim said, on social media, where you can go to a reputable ASPS, American Society of Plastic Surgery, board certified plastic surgeon, preferably who deals only with explants. Because I will tell you, if I call my best friend up and say breast implant illness, they're going to say, what is this? I never learned this in plastic surgery training. Number two, this is a new entity, a new recognition, a new set of problems. You have to be able to remove the implant plus the capsule, because you don't want to remove just the implant and leave the silica behind, like I was saying. So
Right.
you will see, you have to go to someone who understands this relatively new. Now, I will tell you, 3 years from now, 5 years from now, the world of breast implant illness, it will be a much more recognized entity. And there are patients who have now been managed by docs who exclusively do explants and then don't insert implants at all. And good for them. And so I say that as we move forward, and I challenge the biochemists such as myself in training from undergrad, that we take it upon us to do more of the studies, and also having the industry, like the manufacturers, to basically share data. Now, if you go back and look at the initial set of data that the manufacturers themselves came up with, they document in their own manufacturing book and catalog 1.4 to 2% of the patients undergoing these signs and symptoms, which are attributable to breast implant illness. So we see that pattern, that recognition. Had it not been for social media, this one woman from California would not be talking to the one in Florida or
Right.
Massachusetts. And now they're starting to build up on what is the real problem.
Right, and we got to start somewhere. But how can people learn more about you and your services?
So the most important information is education and learning what are we dealing with, how to tackle. If you have a defined problem, going to your primary care doctor, getting the basic subsets of tests, studies, be it imaging, be it an MRI,
So establish a baseline. Okay.
so that you have done the initial filter. Once that has been established, and hopefully we can educate, and I hope to do so, where I can give lectures, just so that we recognize it as an entity. Now, I will tell you, I never guarantee to the patients you're going to be cured of lupus, because I tell them only after time, be it a week later or the same night after you've had the surgery, will you know definitively, be it 3 days later, how well you feel. I just recently did a physician not maintaining well, a professor at Wayne State. Her mentation, being able to think coherently, was altered, and we all know that this is a real problem. And so it becomes more and more, so the patients themselves recognize this pattern and say, let me go ahead and get this check, and hopefully we come up with tests. There is not a single blood test, there's not a single imaging study that will say you have breast implant illness. It's this whole, like we started off the conversation, a constellation of signs and symptoms, where if a patient comes to my clinic, I actually have a questionnaire, and I say, check all what you have, and you'll be surprised, more than half of them are essentially checked.
Did you experience this, Kim?
Yeah. Yeah.
That's what I mean,
Yeah,
the way
yes.
you agreed with him was like
Yeah,
you'd
yeah.
experienced that
Oh, yeah.
as well. So, Dr. Khan, how can people get in contact with you?
So I will say, there are a lot of women all over the world who have implants. Go to an ASPS board certified surgeon, get to talk to them. Go preferably to docs who understand it. Now, I will tell you a little bit more about myself. As a board certified plastic surgeon, as I started working as a general surgeon board certified and as a plastic surgeon, I saw the good and, more importantly, the bad. And I said, I want to practice good. And I say, there are a lot of and millions of women who are happy with their implants, and I say good for you, and hopefully you enjoy and whatever you have. But the subset of women who are not feeling well and who undergo this whole breast implant illness signs and symptoms, there is hope and there is relief. And so don't give up. Go to the ASPS board certified surgeon, the American Society of Plastic Surgery surgeon, who will be able to help guide you and help you with your problems. And hopefully you get the relief that you very much deserve.
Absolutely. Dr. Khan, thank you so much. Kim, thank you so much for joining us on Live in
Oh,
the D
okay.
Extra. And I hope that this is super informative to all of you guys. And leave questions for Dr. Khan. They'll leave questions in the comments, and maybe you can refer back and answer some of them for people and continue the conversation. And also, I think the great thing is that you're helping people to not feel like they're crazy.
Yes.
If something is going on, explore further.
It is real.
It's real.
It is very real. And I say to the ladies, speak, because if you, just like a vote counts, your vote is worth 1,000,000 votes. And so people will listen, and there is no harm in discussing.
That's right.
For me to walk up here and I say, we need to talk about something that very much exists. And there are colleagues and friends of mine who I talk to, and I say, have you looked? And they said, yes, I remember a patient, and oh, this is what they were experiencing. So we know and recognize this entity, which is very much real.
And grow the knowledge. Dr. Khan, great work that you're doing. Thank you so much for
You're
being
welcome.
here. And Kim, also, again, thank you to you
Oh,
as
thank
well.
you.
Thank you, Kim. Thanks.
All right, guys. Thanks for joining us for Live in the D Extra. I will see you next time.
Thank you.
Thank you.
Thank you.
Thanks.